Hi, my name is Rita. I'm going to talk about a TV advert on the medication Humira. In this advertisement, it was interesting to find a lady who was out in the woods by the lake with a group of friends and family members. She was talking about her history of moderate to severe chronic plaque psoriasis, of which she's had several years of having difficulty managing the skin disorder until she found Humira injection. And seeing her, I noticed that she was out with just a short sleeve shirt and shorts, exposing her upper and lower extremities and playing outside happily in the woods without a problem. This tells me that she finally found her freedom to expose her skin, which she says she's not done in years. And she seemed very happy with the new medication she found that her doctor had told her about in the treatment of her moderate to severe plaque psoriasis. Upon seeing this advertisement, it made me very curious to research about this medication. I went ahead and viewed the product insert and found out that, to my surprise, it's an injection that's initially given at the doctor's office. And this injection is a systemic form of medication, which is also a biologic agent for other diseases, which included rheumatoid arthritis, moderate to severe Crohn's disease, psoriatic arthritis, and ankylosing spondylitis. So this tells me that this is a medication that we use for other types of disease process management. But my focus today is basically on the dermatological point of view with moderate to severe plaque psoriasis that I saw on the TV that it was advertised for. And I also finally had a patient who approached me. She's a 35-year-old lady who had had a history of plaque psoriasis since she was a teenager and had used other emulsions, skin topical agents on her skin that had not been successful. I was informed by her that she had also seen the Humira advertisement on TV and was wondering if she would be a good candidate for that medication. She was very hopeful that that would be one of her last resort because she had tried this for several years and her plaque psoriasis had spread to her knees, lower extremity, and arms that she had stopped wearing any exposing skin outfits. She was always staying covered, keeping her hair very long to prevent people from seeing all the skin patches from her plaque psoriasis. With that, I felt she might be a good candidate to try the Humira medication. But going forward, I was in support of her approach to this as long as she was going to be aware of the side effects of this medication. While I watched the advert, one thing that was very clearly pronounced was the indication for side effects of infection. They really emphasized that this medication might make you more prone to infection, some cancers, and hepatitis, immune disorders of some sort. And I inform the patient that she has to be well informed about the side effects of this medication. But as a nurse practitioner, I would like to emphasize to her that before she even thinks about trying that, I would suggest she does go check to make sure she doesn't have any tuberculosis and make sure she has all her immunization up to date with emphasis to hepatitis B. And also make sure she does not have any flu-like infection, any virus infection or bacteria infection, as the use of this Humira medication will make subsequent exacerbation of the diseases she might have. So that'll be my emphasis of instructions while I have her in reference to Humira medication. Also, uh, finally, I will emphasize some of the side effects of this medication. I will inform her too that this medication is an injection, to my surprise, that is given first initial dose at the doctor's office, and then the patient has to self-inject every other week or come back to the doctor's office for the injection if she's not able to self-administer the injection. And I'll let her know about infection, or sorry, I'll let her know about reaction at injection site, and redness or skin irritation, and signs and symptoms to report to the doctor if she does have that, with emphasis on making sure she does not expose herself to areas or environment that will make her prone to having an infection. And if she does have an infection, she needs to report to a healthcare provider as soon as possible. And over time, in reference to the cost of the medication, I was shocked to find out how expensive this medication is. On an average, this medication runs from $1,500 to $2,000 per month. Luckily, one good thing I saw in the advertisements was that the company that made this medication had a financial assistance program which will help patients that cannot afford the medication. And hopefully with my patient, she does have a very good insurance. Her copay will be very minimal, and together with the financial assistance from the company, she will end up not paying anything out of pocket. But it will be a good information to let the patient be aware of the cost of being on this medication. And finally, I'll tell her to give it a try, as long as she's aware of the subsequent side effects that may occur. And if she does have issues like lymphoma issues, hepatitis B, hopefully she will get herself vaccinated before taking this Humira medication. Issues like nervous system problem, heart failure, immune reactions such as lupus like syndrome, liver problem, or worsening of her psoriasis, if indicating that this medication may not be the right one for her. And I guess that'll give her a general summary feedback on my personal impression on the use of Humira advertisement that I saw regarding my patient care. Thank you.